Hip extension is a very powerful movement. The primary hip extensor is a huge muscle on the posterior aspect of the hip joint, gluteus maximus. Now, gluteus maximus was covered in detail in the Introduction to Myology lecture. The movement is then assisted by the hamstring muscles, semimembranosus, semitendinosus, and biceps femoris. All three of them being fusiform muscles that are found in the posterior compartment of the thigh. The primary action of the hamstring muscles is to produce knee flexion. Here is gluteus maximus again. As mentioned earlier, it is an extensor, and because of its oblique nature, it also produces lateral rotation. When the femur is fixed, it produces posterior pelvic tilt, and it assists with movements such as lifting the body up from a forward flexed position. As the upper fibers pass above the axis of rotation of the hip joint, so the axis of rotation of the hip joint will be approximately here, these upper fibers may assist with the movement of abduction. Its nerve supply is via the inferior gluteal nerve, L5, S1 and S2. Gluteus maximus has a very extensive proximal attachment, partly coming from the gluteal surface, from the external surface of the ilium behind the posterior gluteal line, margins of sacrum and coccyx, and the sacrotuberous ligament as well. It has a small attachment also on the deep fascia that covers gluteus minimus. The fibers of gluteus maximus pass downwards and laterally before inserting into the gluteal tuberosity for the deep quarter, and the superficial three quarters pass in between the two layers of the iliotibial tract. So we have tensor fasciae lata entering the iliotibial tract anteriorly and gluteus maximus entering the iliotibial tract posteriorly. These two muscles together will produce tension on the iliotibial tract, and as the iliotibial tract runs downwards and laterally to attach onto the tibia, the function of these two muscles, one of the functions of these two muscles collectively, is to provide lateral stability to the knee joint, especially when the knee joint is flexed. In the second lecture, we spoke about the deep fascia of the thigh, and we saw that the deep fascia, on the deep surface of the deep fascia, we have three intermuscular septa that divide the thigh up into its separate compartments. The anterior compartment, which includes the quadriceps, the medial compartment, which includes the adductors, and then there's the posterior compartment where we can see the hamstrings. The function of the intermuscular septa are to compartmentalize functional groups. The hamstring muscles are the ones found in the posterior aspect of the thigh. They share a common proximal attachment in that all three muscles will blend into the ischial tuberosity. Here we have semimembranosus attaching onto the ischial tuberosity there, and semitendinosus attaching onto the ischial tuberosity here. Semimembranosus passes down before inserting onto the posterior aspect of the medial condyle of the tibia. At this point, it then sends an aponeurotic extension that blends with the capsule of the knee joint. This section often becomes known as the posterior oblique ligament of the knee. Semitendinosus, on the other hand, sits superficial to semimembranosus. It sits on top of semimembranosus. About halfway down, or 2/3 of the way down the posterior thigh, it forms a long cord-like tendon that again goes behind the medial femoral condyle, behind the medial tibial condyle, before going off and attaching onto the anteromedial aspect of the upper shaft of the tibia, back into the pes anserine insertion, lying posterior to the insertion of gracilis, which is the third muscle that forms the pes anserine insertion. The action of these two muscles together is to flex the knee, to medially rotate the flexed knee, and to produce extension at the hip joint. They are both supplied via the tibial division of the sciatic nerve, L5, S1 and S2. The lateral muscle that we have in the posterior aspect of the thigh is biceps femoris. It's called biceps because it arises from two heads. The long head comes from the ischial tuberosity, the common attachment with the other two hamstrings, but the short head arises from the posterior aspect of the lower half of the linea aspera here. The two heads very quickly blend before forming a short, stout tendon that inserts into the head of the fibula. As it inserts, it splits into two. This allows the passage of the lateral ligament of the knee from the lateral epicondyle of the femur to the apex of the head of the femur, of the head of the fibula. The actions of biceps femoris are to produce extension of the hip and to assist with flexion of the knee, but this time it produces lateral rotation of the flexed knee. An understanding of the different action of the medial hamstrings versus the lateral hamstring is important for a clinical diagnosis when the hamstring muscles get torn. The long head of biceps femoris is supplied via the tibial division of the sciatic nerve, whereas the short head, the portion that comes from the linea aspera, is supplied via the common peroneal nerve. Adduction of the hip joint is a relatively weak movement. It's brought about by three significantly large muscles, the adductor longus, brevis and magnus, and assisted by gracilis and pectineus. So the medial compartment of the thigh is this section here. So here we have the posterior compartment, anterior compartment containing the quadriceps, and the medial compartment containing the adductors. And again, all of these muscles will arise from the inferior aspect of the pubis, the body of the pubis and the inferior pubic ramus, the ischium and the ischial tuberosity here. Pectineus arises from the superior aspect of the superior pubic ramus. Pectineus was covered earlier as a flexor. Gracilis, on the other hand, arises from a short aponeurotic attachment that passes from the body of the pubis down to the inferior pubic ramus. Point of note is that gracilis is the most medial of the adductors, so it's the most superficial muscle in the adductor compartment. Halfway down, it produces a tendon that passes down behind the medial femoral condyle, behind the medial tibial condyle, before coming round and inserting in between sartorius and semitendinosus here to form the third tendon of the pes anserine insertion. It produces adduction of the hip and may also assist with flexion of the hip and possibly medial rotation of the flexed knee. Its nerve supply, as the other adductors, is via the obturator nerve L2 and L3. The main adductor group includes adductor longus, adductor brevis and adductor magnus. Adductor longus is the most anterior of our three adductors. It arises from a small rounded cord that attaches onto the body of the pubis. It's a large triangular muscle whose fibers pass downwards and laterally away from the pubis before inserting onto the middle half of the linea aspera. It is an adductor and a flexor of the hip joint, and it has its nerve supply via the obturator nerve L2, 3 and 4. Anatomically, adductor longus is very prone to injury. The reason being that we have a fairly large muscle here converging onto a small tendon.